Kengason explained that Africa is still in its early stage of the outbreak and cases are expected to rise in the next few weeks.
As we expect that by the third to fourth week from now, the virus will begin to seed into different communities or sub-communities. For example, the most vulnerable populations in slums around capital cities, or even expand to remote areas. So I think we begin to understand how severe this pandemic will be. We still don't observe extensively in the remote areas and or slums. It becomes very challenging. Second is we don't just know for now what the comorbidity will play. We have so many people in several parts of Africa, depending on which country, infected with malaria, with tuberculosis and HIV. We have a large number of population that is malnourished. So we just don't know.
African governments were also advised to be proactive to have access as early as possible when a cure has been found.
As we speak, more than 30 candidate vaccines that are being looked into, that is at least, that I'm aware of. I also serve as a board member of the Coalition for Epidemic Preparedness and Innovation. They are accelerating several candidate vaccines across the board. I mean, it has to also be very, very clear that we would not be having a vaccine in the next couple of months. And this will take several months. If we are lucky, maybe 1 year or 1.5 years before we have an effective vaccine that will be safe and efficacious in people. I also know that there are multiple clinical trials going out there, and we are hopeful that some of those will lead to very promising results.
The pandemic has now spread to 46 countries in Africa, with over 6,600 cases currently recorded. More than 200 patients have so far recovered in 14 countries.
That the currently reported laboratory for confirmed case counts are a gross underestimate of the true burden of COVID-19 disease because of the current case counts are an underestimate. Part of that is due to some of our own challenges around trying to prioritize testing for people that we think are most likely to have disease.
Juliana Fuka, NBC News, Windhoek.